Welcome to the What You Should Know About Congestive Heart Failure webinar from NYAIL. Christine Trimboli, our Open Doors Money Follows the Person nurse, will be presenting today. Welcome, Christine. Before we start, I just want to do a few housekeeping items. So Christine is going to be answering questions at the end of the presentation. If you have questions, you can ask them through the questions bar, which is on your dashboard, or you can raise your hand. You should have a little symbol that looks like a hand, and you can raise your hand and I can unmute you and you would be able to ask the question verbally. When I do that, I'll just say, for example, Amy, I'm unmuting you so you can ask a question, so you'll know when you're unmuted. So without further ado, Christine, take it away.
Okay, thank you, Suzanne. First, before we get into the next slide, I want to just talk to you about the normal heart before we get too far into the diseased heart. A refresher for many of you to consider is the heart is about the size of a closed fist. It lies between the sternum and the mediastinum, which is the cavity between the lungs, between the second and sixth ribs. The heart is surrounded by a sac called the pericardium, which serves to protect it. And the heart has a wall made up of 3 layers. The epicardium is the outer layer, the myocardium would be the middle layer, and the endocardium is the inner layer. Your heart is really an amazing organ when you think about it. It's constantly pumping oxygen and nutrient-rich blood throughout your body to sustain life. Think of it as a fist-sized power horse that beats expanding and contracting 100,000 times per day, pumping between 5 or 6 quarts of blood each minute, or about 2,000 gallons per day. And not that we timed it this way, but I just realized that February is American Heart Month, so the timing of this worked out without even really trying. Suzanne, next slide, please. Okay, so what is congestive heart failure? You also hear it as CHF. It's a progressive disease in which damage to the heart causes weakening of the cardiovascular system. It occurs when blood backs up or congests into the liver, abdomen, or the lungs. And it typically happens when the heart muscle is damaged, weakened, stiffened, or enlarged. Again, thinking of our heart as a pump that pushes blood throughout our bodies, sometimes this pump weakens and isn't able to keep the blood flowing as well anymore. The term congestive heart failure, also known as heart failure, may sound like the heart has stopped working, but actually it just means the heart is not pumping as effectively as it should. CHF is a cumulative consequence of all insults to the heart over someone's life. Next slide. So this is just a diagram that you can refer to. It shows the pulmonary valves, pulmonary veins, all the arteries again, veins. It shows the unoxygenated blood picking up oxygen and pushing it back out through the body. Within the heart, there's 4 chambers. You're going to see 2 smaller and 2 larger, and 4 valves. A system of blood vessels carries the blood to and from the heart. The heart circulates blood through the 2 separate systems. The 2 chambers on the top, the atriums, are receiving stations for the blood, and the 2 lower chambers, or ventricles, are the pumping stations. Your left ventricle forces oxygen-rich blood into your arteries, which carry it throughout your body. The blood returns to the right atrium, which passes it down to the right ventricle. which then the right ventricle pumps the blood to the lungs where it picks up oxygen, with oxygen-rich blood then being returned to the left atrium, which dumps it into the left ventricle, and the cycle repeats itself. The valves between the chambers prevent, so to speak, backwash. Next slide. Okay, CHF is often the end stage of many cardiovascular conditions. It has both psychological and social impacts, and the American Heart Association reports that nearly 5 million Americans have heart failure. Of those, half who are diagnosed die within 5 years. There is no cures, but medications and a healthy lifestyle can help manage or maintain quality of life. CHF can be more involved when other comorbidities or conditions are present, such as kidney disease, hypertension, diabetes, vascular disease, which is any condition that affects the circulatory system. Next slide, please. Okay. It goes without saying that as people live longer, the occurrence of heart failure rises, as well as other conditions that complicate its treatment. And even when the symptoms are absent or controlled, impaired heart function implies a reduced duration of survival. CHF affects people of all ages, from children and young adults to the middle-aged and elderly. The prevalence of CHF approximately doubles with each decade of life. There are approximately 550,000 new cases diagnosed in the United States each year. The annual incidence of CHF approaches 10 per 1,000 population after 65 years of age. Also of interest is that the incidence of CHF is equally frequent in both men and women, with African Americans being 1.5 times more likely to develop heart failure over Caucasians. And heart failure is responsible for 11 million physician visits each year and more hospitalizations than all forms of cancer combined. CHF is the first listed diagnosis in 875,000 hospitalizations, and the most common diagnosis in hospital patients ages 65 years and older. Heart failure contributes to approximately 287,000 deaths a year, and again, more than half of those who do develop CHF die within 5 years of receiving their diagnoses. Next slide, please. Okay, so what happens during CHF? During heart failure, the body attempts compensation for reduced blood flow by the following: by enlarging the heart chamber so that it can stretch and contract more strongly to pump more blood, by developing more muscle mass, because the contracting cells of the heart get bigger, resulting in the heart pumping more strongly, pumping faster with the goal of increasing the heart's output, and diverting blood away from other tissues and organs such as the kidneys, heart, and brain. These compensations may mask heart failure temporarily, but eventually heart failure progresses to the point where people start to experience fatigue, breathing problems, and other symptoms. This may explain why sometimes it can take years for someone to realize that they have heart failure. Next slide, please. The heart's inability to pump blood to the muscles and organs isn't always apparent in the early stages of heart failure. Often it becomes obvious during increases in physical activity. In advanced heart failure, many tissues and organs may not receive the oxygen they require for functioning at rest. Next slide. Okay, so CHF occurs due to a decrease in blood flow. There is a backup, or what we know as congestion of blood into the lungs, liver, abdomen, and the lower extremities. And someone may have shortness of breath or weakness and not have a fluid buildup. Not important to note is not all heart failure is congestive. Next. I put this in just to show various symptoms of CHF. Again, looking at shortness of breath. It can be caused by congestion in the lungs. You've also may have heard of people with pulmonary edema. One sign to watch for is whether or not shortness of breath is worse when someone is laying flat. One of the other illustrations, you can see that someone may have difficulty sleeping at night due to breathing problems. Or it can be referred to as orthopnea, which is shortness of breath, which occurs when blood kept in the legs by gravity returns to the chest when someone goes to bed at night and is lying down. So it's a gravity issue. You may have swelling of the feet and legs, which is referred to as peripheral edema, again, due to the force of gravity. Swelling of the feet and legs may also be a result of right-sided heart failure, since fluid cannot be pumped to the lungs at an efficient rate, and they back up in the veins, leaking out into the capillaries and accumulating in someone's tissues. Also, you can have a decrease in blood flow to the kidneys, resulting in decreased perfusion, which can also lead to an increase in fluid retention. Sometimes people with CHF, due to their symptoms, can have a reduced appetite. Often diuretics are prescribed to help get rid of this excess fluid and reduce the strain from the heart. Again, in looking at the last picture with confusion and or impaired memory, it all comes down to reduced blood flow and not enough oxygen being carried to get those symptoms of confusion and impaired memory that happen in the later stages of CHF. Next. Okay, other types of heart failure. The left-sided heart failure, the left side brings oxygen-rich blood from the lungs through the left atrium to the left ventricle, then out into the body. When the left side of the heart is damaged or it can't pump as well, it has to work harder, which can cause fluid to build up, especially in the lungs. That's why shortness of breath is one of the most common symptoms of heart failure. With left-sided heart failure, you may have what's known as systolic failure, which means the heart is not pumping out the blood as it should, or diastolic failure, when the heart doesn't fill back up with blood. The symptoms and physical changes of heart failure have several different classifications based on their location and mechanism. And it's important to note that the left ventricle supplies most of the heart's pumping power, so it's larger than the other chambers and essential for normal function. Next, please. Okay, so we have right-sided heart failure, which the right side of the heart usually becomes weaker in response to failure from the left side. The right side brings in circulated blood from the body and sends it to the lungs for oxygen. As the heart muscle loses strength, blood and fluid become backed up, causing swelling and shortness of breath. Right-sided heart failure usually occurs as a result of left-sided heart failure. When the left side weakens, the right side has to work harder to compensate. And with this, increased fluid pressure is transferred back through the lungs, damaging the heart's right side. When the right side loses pumping power, the blood backs up into the body's veins. This usually causes swelling or congestion in the legs, ankles, and within the abdomen, such as the GI tract and liver, causing something called ascites. Ascites is an accumulation of fluid in the abdominal cavity. You may have heard the need for someone to have a procedure called a paracentesis, and this would be a reason why. Paracentesis is a procedure used to remove excess fluid from the abdomen. Next. Okay, so heart failure is grouped into classifications. Class 1, there are no limits to someone's physical activity, and any ordinary activity does not cause fatigue, palpitations, or dyspnea, which is another word for shortness of breath. Next. With Class 2, there is a slight limitation to someone's physical activity. They may be comfortable at rest, but ordinary physical activity results in fatigue, palpitations, or again, shortness of breath. Next. Class 3, physical activity is limited. They may still be comfortable at rest, but less than ordinary activity causes fatigue, palpitations, and shortness of breath. And as you notice in these slides, you may have not noticed, but the heart is getting bigger, and that is the result of the enlargement of the muscles, and it does not always mean that the heart, obviously it doesn't mean that the heart's getting stronger, but it can get bigger. Next slide. And the last classification is Class 4. Someone is unable to carry on any physical activity without discomfort. They have symptoms of failure at rest. If any physical activity is undertaken, their discomfort increases. And if you can see from the little heart figure, they definitely look like they're working really hard. Next. So what are the risk factors for congestive heart failure? You'll see listed out, we have coronary artery disease, high blood pressure, someone may have faulty heart valves or damaged heart muscle, history of heart attack, MIs. They may have congenital heart defects from birth. Other risk factors are smoking, poor diet, and lack of exercise. Next. So what are the goals of treatment for CHF? One is to address any underlying causes, reduce and manage symptoms, and improve health. There are several lifestyle changes as well as drugs and surgeries that can help people diagnosed with heart failure, and we'll be going into some of those. Next. Some examples of treatment for CHF may include the following: medications, inpatient treatment, surgery, heart transplant, implanted devices, and lifestyle changes. A heart transplant or a cardiac transplant is a surgical transplant procedure performed on patients with end-stage heart failure or severe coronary artery disease. There is a long waiting list for heart transplants, and not everyone is a candidate. And there are very strict guidelines and screening that someone has to go through to determine if they're eligible for a heart transplant, involving even working with a social worker and looking into all the impacts it will have on their life. And also a sense of whether they will be compliant afterwards. So again, a lot of factors. A heart transplant removes a damaged or diseased heart and replaces it with a healthy one. The healthy heart comes from a donor who has died, and it is the last resort for people with heart failure when all other treatments have failed. Although it's considered a life-saving measure, it has many risks to it. Careful monitoring, treatment, and regular medical care can prevent or help manage some of these risks. After the surgery, most heart transplant patients can return to their normal levels of activity. However, of note, fewer than 30% return to work for many different reasons. Next. We're going to spend a little bit of time going through some of the different classifications of medications that are used to treat for CHF. I'm going to try not to spend a lot of time in this section. You can refer back to it or contact myself for any further information, but I just want you to have an idea, again, of the classifications and what they do. So first off, we have ACE inhibitors, which stand for angiotensin-converting enzymes. So if you have someone that you're working with and transitioning and they're on an ACE inhibitor, the purpose is to widen and relax their blood vessels with the ultimate goal of lowering their blood pressure, to reduce the workload or the strain on their heart, prevent undesirable increases in heart size, and to improve something called the ejection fraction, which is a measurement of the percentage of blood leaving your heart each time it contracts. Heart failure patients can need multiple meds, and each one treats a different symptom or contributing factor. For ejection fraction, I wanted to let you know that during each heartbeat cycle, the heart contracts and relaxes. When your heart contracts, it ejects blood from the two pumping chambers or ventricles. When your heart relaxes, the ventricles refill with blood. The left ventricle is the heart's main pumping chamber, so ejection fraction is usually measured only in the left ventricle. An ejection fraction of 50 to 75% is considered normal, indicating the heart is pumping well and able to deliver an adequate supply of blood to the body and the brain. Someone with an ejection fraction between 36 to 49% is below normal, and 35% or below is low. Anything below 50% indicates the heart is no longer pumping efficiently to meet the body's needs, indicating a weakened heart muscle. The combination of poor pumping and a low ejection fraction can occur if the heart muscle has been damaged due to a heart attack, a diseased heart valve, or heart failure. Of interest and of note is a healthy heart does not pump 100% of the blood out during each beat. Some blood always remains in the heart. Okay. Next slide. Okay. So this just goes on. We talked about the action. Actually, can you back up one slide, Suzanne, for a moment? Okay. Next one. Okay. Okay, so some of the potential side effects I have listed out. I'm not going to go over every one of them, but they're there for you to use as a reference, and you'll see some of the names down below: lisinopril, Vasotec, Hapatin. These are drugs that you may hear of. Next slide, please. Okay. Another classification of meds you may have heard of are called angiotensin II receptor blockers. You may hear them more commonly referred to as ARBs. ARBs are an alternative to ACE inhibitors if they are not tolerated. And under ARBs, we have beta blockers and aldosterone blockers. The beta blocker's job is to slow the heart rate and reduce blood pressure, as well as to limit or reverse some of the damage caused by heart failure. Aldosterone blockers block the effects of the hormone aldosterone, which causes sodium and water retention that can contribute to heart failure. Next. This just continues on with some potential side effects that you can refer back to: fatigue, abdominal pain, etc., and some examples of names that you may see, such as Diovan, etc. What is exciting is in 2015, a combination drug of both an inhibitor and an ARB was approved for use, and this is known as Entresto. You may also have heard of it referred to as valsartan. It was shown to reduce hospitalizations and deaths. Next. Another medication classification are called vasodilators. Their purpose is to relax blood vessels, which lowers the resistance against which the heart has to pump. Vasodilators increase blood supply and oxygen to the heart, and you can see some of the side effects down below with the low blood pressure, known as hypotension, dizziness, etc. You'll see some names: apresilene, Isordil, any of the nitrates. What's really important for anyone you're working with who may be placed on a drug in this classification is to always have them sit quietly on the side of a bed or chair and not to change positions or to get up abruptly, especially until their tolerance to the med has been determined. Next slide. Okay, the next classification that you've probably all heard of is beta blockers, and their job is to block the heart cell response to something called catecholamines, which are basically norepinephrine and epinephrine, which are compounds that cause the heart to work harder, increase blood pressure, and to increase the blood flow to the muscles. Beta blockers may reduce the energy needs of the heart, and they can also reduce the heart size and improve the function of the heart overall. Next. And here you'll see, again, some of the side effects to look for and some of the names that you may have heard of: Coreg, Metoprolol, Toprol, XL, etc. Next. Okay, another classification of a med for CHF is called digitalis. The purpose of digitalis is to increase the strength of the heart's contractions, reduce the resistance in the blood vessels. It can also work to decrease certain irregular heartbeats. And again, some side effects to look out for: nausea, vomiting, and examples of names. You may have heard of digoxin or lanoxin. Next slide, please. Okay. Another classification of medications are your anticoagulants. These help to prevent blood clots from forming in the heart chambers, veins, or arteries. In small arteries, such as the coronary arteries, anticoagulants may prevent clots from forming. People usually hear about anticoagulants more than the other classifications because of their really big potential side effect of bleeding. And some examples you'll see are Coumadin, Xarelto, Pradaxa, heparin. In fact, on TV lately, I know there's been a slew of, I call them the ambulance chaser commercials. You know, if you've been affected by bleeding from Xarelto or Pradaxa, call this number. So that is the anticoagulants. They're also known as blood thinners, although they actually don't thin the blood. They do not dissolve existing blood clots, but may prevent them from becoming larger and causing more serious problems. And a certain anticoagulants can be prescribed to prevent a first or recurrent stroke. Next. Okay. Another classification of medications for CHF treatment are your cholesterol-lowering medications. It's known that a high level of cholesterol increases the chance of someone having a heart attack or stroke due to plaque buildup in the arteries. And you'll see some of the potential side effects, especially the abnormal function of the liver. People will often, be having liver enzyme studies done fairly regularly when they're placed on a medication in this class. And you'll see some common examples of names such as Lipitor, Zocor, Crestor, etc. Medications that are available to lower cholesterol work best, however, when they're combined with diet and exercise. Next slide. Another classification of meds are your aldosterone blockers. Aldosterone is a hormone released by the adrenal glands in response to a decrease in blood flow to the kidneys and other factors in heart failure. I have some of the side effects listed out for you: fatigue, headache, etc., and some examples of names such as aldactone and Inspra. The blocking effects of aldosterone may improve outcomes in more advanced heart failure. Next. Okay, so we go to our diuretics, which is also very basic, sometimes first-line treatment for CHF. Diuretics, you've also heard people refer to them as water pills. Their job is to help eliminate excess fluids from the body. They cause the kidneys to increase urine production, and they increase the body's excretion of sodium chloride and potassium. They can cause potassium and sodium levels to be depleted, and often for this reason, electrolyte studies and labs are done, especially when someone is placed on diuretics and at certain intervals to monitor. It's important for people to think about incorporating some type of potassium-rich food in their diet, such as bananas, when they are receiving diuretic medications. Continue. Next slide. Diuretics are used to relieve both pulmonary and peripheral edema. And again, the pulmonary edema would be causing your shortness of breath and so forth. And the peripheral edema is when the fluid is leaking out from the capillaries and increasing someone's ankle, foot size, etc. Diuretics can also treat hypertension. You may have heard of some of your consumers using a diuretic for that because of the outcome of the diuretic dilating someone's blood vessels. So again, it can be very effective and helpful in the treatment of hypertension. Again, I've listed some side effects that you can refer to: dizziness, muscle cramps, etc., and a few common names such as Lasix and hydrochlorothiazide. Next. Sometimes for treatment of CHF, someone needs to become an inpatient. In advanced cases of heart failure, hospitalization may be necessary for specially prescribed IV medications, because some of these medications are not as effective when taken orally. So sometimes it's quite common to hear of patients who have to go into the hospital even just for intense IV administration of Lasix, for example. You may have heard of like a Lasix IV push. Again, it needs to be monitored and done in a controlled setting. Next. Okay, we're going to just touch lightly on some different treatment options, some further treatment options for CHF, and we're going to look at surgery and procedures. You may have heard of people needing a coronary artery bypass graft. This involves using an artery from the chest wall or removing veins from the legs and grafting them to the coronary arteries. The narrowed area of the coronary artery is then bypassed and blood flow to the heart muscle is redirected. Valve surgery is another procedure in CHF, and severely blocked or leaky heart valves can be repaired or replaced during open heart surgery. Tissue valves, you've heard of bovine, can come from cows, pigs, etc. They often do not require the patient to take blood thinners. So sometimes for this reason, that is a more popular choice for people to do a tissue valve replacement versus a mechanical replacement, which does require use of blood thinners. You may have heard of something called a percutaneous transluminal coronary angioplasty, known as PTCA. With this, a catheter with a balloon on the end of it is threaded up into the arteries that supply the heart. The balloon is then positioned and inflated to open the artery. And next, we have left ventricular assist device. Patients who are not candidates for heart transplant may benefit from placement of a LVAD. It's intended for patients, again, with end-stage heart failure. It pumps blood through the body when the heart is not strong enough to adequately do it by itself. And it's known as a left ventricular assist device because it helps the left ventricle, which is, again, is the heart's main pumping chamber, circulate blood throughout the body. The device consists of a pump that is implanted into someone's abdomen, which has an electrical cable that connects to external battery packs. The packs are then worn on the shoulders, and electronic controls are worn on the belt. Next. Heart transplant. In end-stage heart failure, this may be the best option to replace the heart. Because of the shortage of donors, heart transplant recipients may wait months or years for a new heart. The survival rate in cardiac transplantation in appropriate individuals is 95% perioperative, 85% 1 year post-transplantation, and 65% 5 years after transplantation. And next. So some of the most simple treatments for CHF are lifestyle changes. Someone to quit smoking, avoid or reduce their alcohol consumption, maintain a healthy weight, get moderate amounts of exercise, eliminate or reduce salt consumption, limit fluids. And again, lifestyle habits can really help relieve symptoms of heart failure and keep the condition from getting worse. Next. Also important to eat a heart-healthy diet, get adequate rest and sleep, control blood sugar if you have diabetes, control high blood pressure, check the legs, ankles, and feet for swelling daily, keep vaccinations current, and reduce stress. Next, please. So our ultimate goal is a nice, heart-healthy, strong, pumping heart. And what I wanted to mention, if anyone wants to look into this, one of the leading research and authority on heart failure, and particularly replacement and other surgeries is the Texas Heart Institute. And right now it's really exciting because they're really working on a totally artificial heart. And back in 2011, they actually implanted 2 approved devices into a 55-year-old, which were used as a last attempt to save his life. But they're really doing some exciting research, and we should be hearing, you never know, within the upcoming few years of artificial hearts, eliminating that long waiting list and finding appropriate donors. So again, if anyone wants to look into it, it's the Texas Heart Institute. And next. Okay, so be happy to open up to any questions that anyone has, or even a discussion about someone without names, of course, that you're working with, that you have anything that you want to run by us.
Okay, so anybody who wants to ask a question, just raise your hand, and then I will unmute you so that you can be heard by everybody. All right, so Christine, while we're waiting for people to raise their hands, I'll just ask, so when a transition specialist sees CHF under the list of diagnoses, what would you say is the most important thing for them to either find out or plan for?
Okay, so if they're working with someone with CHF, so one of the first things that is to determine whether the person that they're working with is compliant and following the basic recommendations of, low cholesterol, reduced sodium, activity is tolerated. I think it's really good to try to get an accurate portrayal of the person that you're working with, if they're motivated and if they're compliant. If they are, that's wonderful. You might look at their medications, some of these different categories that we discussed today might look familiar when you see them on their medical records. But basically, I would say compliance, and to make sure that when you're working with them going out into the community, that you're really taking into consideration all of the different symptoms of CHF and noticing that they're becoming more short of breath or wheezing or their lips are turning blue. So you want to just be kind of looking at them to see if there's any areas that you have concern and bring it to the attention of someone. You may notice something with the person that you're working with far before they notice it themselves.
And so would you say referral to a nutritionist or a nutrition specialist might be warranted? I know some people aren't clear exactly when you say, oh, low cholesterol foods, and they might think, oh, anything that's a vegetable, or, they might not be entirely clear what heart healthy diet might mean.
Oh, absolutely, and not to just assume that these referrals have been made. So looking over their records, if a nutritional consult hasn't been ordered, you can ask the social worker, whoever you're working, this is if the patient is still in the facility, and if they're not, then you can help advocate with their personal provider out in the community. So again, looking for dietary consults, even something as simple as occupational therapy doesn't always come to someone's mind, but when you're trying to have energy conserving, especially with someone with more advanced heart failure, working with an occupational therapist on breaking down different activities in the day smarter and maybe using some assistive devices can also be very helpful. Of course, they obviously may come, they may be on oxygen. They may be receiving oxygen therapy at home, either 24/7 or just as needed.
Mm-hmm. And Laura Bengal is pointing out that there's new dietary recommendations from the USDA on low sodium. So Laura, I'm just going to unmute you. Laura, can you hear us?
Yes, I can hear you.
Okay, we can hear you now.
Yeah, when you were saying about the sodium or the dietary referral, there are so many things that our diet really does play in. And with the heart function, it's very important that a person realize what they eat can affect them so dramatically. And you mentioned cholesterol, and it just brought to mind the new recommendations that just came out, and they can be found on the USDA and another governmental website, CDC as well. But they're really encouraging people to look at the amount of sodium that they have in their diet, because the United States population is taking in way too much sodium, and hypertension really plays into a lot of these chronic diseases.
That's a good point, Laura. All right, so I don't see any raised hands for questions. So if there are no further questions, thank you very much, Christine. That was very informative, and thanks, Laura, for your input as well. And, as always, Laura and Christine are both available if you have a specific person that you're working with, and both of them are very happy to work with you and give you information and answer any questions you might have about a specific person. And you can see both Laura and Christine's contact information is listed right there on the final screen. So thank you very much, everyone, for attending, and we'll be talking soon, I'm sure.
Thank you.